Hi, I'm Manni Chadha. Welcome to Health Tech Decoded, where you get answers to all your queries related to healthcare technology. Today, we'll talk about pre-authorization of treatments that the providers have proposed to patients. And this pre-authorization is required so that you can avail your insurance benefits properly. Pre-authorization is a prospective review. So this prospective review is done for routine referrals and it's also done for urgent referrals, but it's never done for ER admissions. For emergency admissions, we never require a prior authorization. So this review can happen either before the admission or even after the admission to the facility, but it always has to complete prior to the treatment beginning. So in many cases, the doctor's orders are even overridden because the reviewers feel that's not required. So this pre-authorization, it manages the costs by keeping a control on expensive drugs, expensive diagnostic imaging, and even expensive therapies, and some non-emergency surgeries if not required. And then there's also watches for the medical necessity that whether this particular kind of a treatment is required or not required, and then whether the criterias are met or not met for this treatment. So I'll just give you an example. If there is a rheumatoid arthritic patient and that patient is proposed a physical therapy treatment, but for the physical therapy to happen, the criteria is that the diagnostic imaging, was it done for this patient or not done? And if diagnostic imaging was done, inflammation has to be taken care by some prescribed medicines or even some physical therapy. Such prior treatments like the diagnostic imaging does help in such a case that the proposed treatment is definitely required. Then this prior authorization process also keeps a check on duplication of services, that whether the PCP or whether the specialists that don't advise some duplicate treatments, like for example diagnostic imaging, it's not duplicated in some patients. Then the benefits for the prior authorization is that the prior auth of medical equipments, it does ensure that the suppliers payments will be made 100% because the suppliers knows that the prior authorization is achieved already for the equipments that the supplier is providing. And then the it also protects from improper payments, this prior authorization process. And then there's one more major advantage of the prior authorization process, that the providers have to maintain some the medical documentation of patients because that can be required anytime for the purpose of prior authorization. So here on this flow diagram that I'm going to show you, I will show that how the 278 electronic files help for the purpose of prior authorization flow. The patients would come, the doctors would advise some procedures or some lab tests. The labs or the facilities would send the information for the prior authorization process. So, the information that has to go for the prior authorization to the payer would include the subscriber and the patient details, the diagnostic treatment details, some additional information. And this all will go to the payer in the form of a 278 file, the 278 request file. The 278 can also be in the form of a notification file at times, even acknowledgement, or even an inquiry file. When the payer on this side receives this 278 file, they perform a patient and the subscriber matching and they validate the diagnostics and the treatments and then the outcomes of these treatments. And if required, they would send the pre-authorization code. If it is all approved, they would send a pre-authorization code. And if not approved, they would send more information required from the provider. So they would send all that information electronically back, again in the form of a 278 response or a notification or an inquiry or an acknowledgement. Once all that treatment is done on the provider's side, the claim, a healthcare claim is now generated, which is in the form of a 837 professional or a 837 institutional claims. So the 837 professional or institutional claim will carry the entire details of the healthcare that has been provided to the patient. And then it would also carry the details of the pre-authorization code, which was earlier sent to the provider. Now, after the claim has been received by the payer, they would send either an acknowledgement file or they would also do a pricing of the healthcare claim if required. So this was the entire flow of pre-authorization, which I want to again showcase here, just the steps that we've already gone through. So it's just a highlight of what we just talked about. It's a perspective review workflow. The provider has to submit the required information. If required, they'll ask for more information, the payer, and the provider will submit any missing information if required, and then the payer has to finally, in 2 business days, provide the final response to the provider. So this was the entire pre-auth workflow. And the files that we have used in here are the electronic files, X12 transaction sets that we've used here. They are the 278R, which stands for, which is either for request or for the response that is sent back from the utilization management to the provider. And then it's a 278N also. It's a notification that the admission has happened, the authorization to admit a patient from the provider, and then the authorization for a pre-certification of any service. That's again in the form of a notification file. And then acknowledgements are exchanged by both parties in the form of a 278A acknowledgement file. And if there's any inquiry that has to happen, that's done in the form of a 278I file, an inquiry file. I hope I was able to clarify all your doubts in relation to the pre authorization workflow. So don't forget to hit the like and subscribe button in case you want more such info, in case you are always interested in the healthcare technology.